All right, so I think I'm going to discuss what global surgery is and what the challenges and benefits are. So, from my own understanding, um, global surgery is probably it's basically surgeons sitting together and decided that surgery is a global problem. Surgeons, we are very sort of individualistic, so we like our own kingdoms working in our own ways. But I think at some point we discover that surgery is actually bigger than us as individuals. So, and I think that's where the concept came from. This is my own hypothesis that surgery is not just me and my theater and my patients, but it's I need to think of it as a public health issue. And I think that's the birth of global surgery. As usual, it's probably driven by the West by and large. And that's where the ideas come from, that's where the meetings happen. So I think that's one of the first challenges is that it's very the disparity between high income countries and low income countries, and how do you merge these two, and how do you have one place help the other? How do you make decisions for places that are so far apart in terms of resources? I think that's one of the biggest challenge. The other challenge is just that I think part of the drive is to try and address surgical challenges in developing countries. But unfortunately, like I said, for most of these decisions, in my own opinion, are made in first world countries. And even like from my own setting, the guys who are involved in global surgery are mostly surgeons who work in cities, and they are by and large practicing what I would say first world surgery. So they really don't know what happens to a rural surgeon. They are so far removed from this. They just hear about global surgery decisions being made, but they don't really know what that um, what that involves. So I think that's the other challenge. So the guys who really need we need to have input from who work in these settings that they have very limited resources, no support, either financially, and actually the goal should be the patients that they see, because I think if it's all focused on just the field but not on the patients who we serve, then it totally misses the point. So I think the focus should be on the very rural patients, even in developing countries, who really have no access to surgery, and how this is going to help them. Um, the benefits, I think it's a good thing. Like as surgeons now, we are thinking outside the box. We are thinking of surgery as a public health problem, as opposed to just thinking it in a very having a tunnel vision of what surgery is about. So that's a good thing. And now I think as a group, we now have a voice, and you can say global surgical groups have decided this and this is important, or this is what we are driving. This is what is happening in the world over. This we can collect data from different settings and try to see how can we steer surgery towards certain directions. So I think those are the benefits, and of course now all the help that comes from more developed places to underdeveloped places in terms of teaching, in terms of resources, in terms of just feeling part of this bigger thing than just the local surgeon or the country societies or even continental societies. And I think that's where the benefit comes in.